I welcome you again to Anatomy Snippets. And today we will be discussing about first arch syndromes review. So before really diving into the topic of first arch syndromes, I'm going to be discussing briefly about pharyngeal arches, pouches, clefts, the various nerves, muscles, and even the arteries of the arches, and then followed by first arch in a little bit detail, and then the two syndromes of first arch, that is Treacher-Collins syndrome and Pierre-Robin's syndrome. Before that, a brief introduction about myself. I am Dr. Amey Anil Munemane, intern and founder president of BVDOMC Quizzing Society. So let's go into today's snippet, that is snippet number 11. This topic is actually a core topic of embryology, and for preparing this presentation, I have taken help from mainly two books, that is Yogesh Sonthake's Embryology and the gold standard book for embryology, that is Langman's Medical Embryology. So pharyngeal apparatus essentially is made up of pharyngeal arches, pouches, and clefts. So what are pharyngeal membranes? Pharyngeal membranes, they are basically area of contact between the pharyngeal pouches and the clefts. Now pouches are from the endoderm, whereas clefts are from the ectoderm. So each pharyngeal arch is basically nothing but a mesenchyme on the outside and the epithelium on the inside by the surface ectoderm. The muscular component of each arch will have their own cranial nerve. Also, an arterial supply will be present, which is a unique arterial supply for that arch. So this is the development of pharyngeal arches going from the leftmost image to the rightmost image. The leftmost image is at 25 days intrauterine, obviously. Then middle one is at 28 days intrauterine, and the rightmost is at 5 weeks intrauterine. So at 5 weeks intrauterine, you can see that the pharyngeal cleft, the limb bud, and the pericardial swelling is formed. Whereas when we go from 25th day intrauterine life, there was vitelline duct, the pericardial bulge, cranial neuropore on one side and connecting stalk on the other side. So these are the derivatives of pharyngeal arch. The first arch is the mandibular arch, made up of the maxillary and the mandibular processes. Nerve is the trigeminal, mainly the maxillary and mandibular division. So muscles mainly of muscles of mastication, as well as lateral pterygoid, mylohyoid, anterior belly of digastric. The second arch is hyoid. Nerves is the seventh cranial nerve, which is the facial nerve. So muscles of facial expression like buccinator, orbicularis, frontalis, platysma, digastric. Okay. Third arch is basically supplied by your glossopharyngeal nerve, supplying the muscle stylopharyngeus. Fourth to sixth is by vagus, superior laryngeal branch of vagus to the fourth arch, whereas recurrent laryngeal branch to the sixth arch. Muscles supplied are cricothyroid, levator, palatine, and intrinsic muscles of the larynx. So this is a diagram showing the pharyngeal arches in a cross section. Again, the cranial nerves are shown in this diagram. We can see ophthalmic branch of cranial nerve 5, maxillary branch of cranial nerve 5, mandibular branch of cranial nerve 5. So all the three divisions of trigeminal nerve. Then ninth cranial nerve, which is a glossopharyngeal nerve, 10th vagus nerve, 7th facial nerve. So these are, as I have discussed in the previous table, these are all the specific nerves that are contributing to the nerve supply of the respective pharyngeal arches. So any pharyngeal arch can be broadly divided to understand it better into mesoderm and neural crest cells. Under mesoderm, you have the muscle and the pharyngeal arch artery, whereas under the neural crest cells, you have the connective tissue and the nerves. So arteries of arches, I already told you that each arch has got its own arch artery, and these arch arteries connect the dorsal aorta with the aortic sac, and this aortic sac lies ventrally, whereas the arch arteries, they lie dorsally. So first aortic arch artery is a part of the maxillary artery. Second aortic arch artery, stapedial artery and hyoid artery. Third aortic arch artery, common carotid from the ventral part of the third aortic arch, and stem of the internal carotid artery from the dorsal part of the third aortic arch. Fourth aortic arch artery has got preference for sides. So on the right side, proximal part of the right subclavian artery. On the left side, arch of aorta. Fifth aortic arch artery disappears completely. This is an important fact for all of us students to remember, because this has been asked as a question in PG entrances before. Then sixth aortic arch artery, similar to the fourth aortic arch artery, has got a preference to sides. On the right side, right pulmonary artery. On the left side, left pulmonary artery and ductus arteriosus. Now, what does ductus arteriosus form after birth? Ligamentum arteriosum. Now, let's really go into the topic, which is the first arch. So first arch is differentiated into a cranial maxillary process and a larger caudal mandibular process. So this cartilage of the mandibular part, the first arch is called as the Meckel's cartilage. And the Meckel's cartilage forms the malleus from the dorsal part, malleus and incus from the dorsal part, and the anterior ligament of malleus from the perichondrium. First arch syndromes will obviously occur due to the failure of migration of the neural crest cells, right? Treacher-Collins syndrome, also known as mandibulofacial dysostosis, named after the person who first gave it, Edward Treacher-Collins, in 1900. It is autosomal dominant in inheritance, which occurs due to the mutation of TCOF1 gene located on the chromosome number 5, having incidence of 1 in 50,000 births. The way this syndrome presents is underdeveloped lower jaw, also called as mandibular hypoplasia, underdeveloped zygomatic bone, also called as malar hypoplasia, downslanting palpebral fissure, and the external ear malformations, which are your malform pinna and the meatal atresia. This is the image taken from Cleveland Clinic website, in which we can see that the eyes are having a downward slant. There is a small flattened cheekbones, small oddly shaped ears with an inherent cleft palate, which is present in Treacher-Collins syndrome. Pierre-Robin syndrome, the cause is anomalies of chromosome 2, 11 and 17. The mutation is in SOX-G gene on chromosome 17. The incidence is 1 in 10,000 births. So Pierre-Robin is more common compared to Treacher-Collins. Clinical presentation is a cleft palate, retrognathia or a small mandible, and glossoptosis, which is a backward displacement of the tongue. Again, the image taken from Cleveland Clinic website. High arched cleft palate, roof of the mouth, large tongue, and underdeveloped small chin. So I want you to pay attention to this fact that there is cleft palate in Pierre-Robin syndrome as well as a Treacher-Collins syndrome. But the way to differentiate is based on these features. First of all, the chromosome numbers involved, the gene mutations, and the other specific clinical features. I hope the review on the topic first arch syndromes was useful and was up to your expectation that has been set by all of us in the previous snippets. If you have any suggestions or comments, I request you to mail us on our official email ID, pvdmcquizingsociety@gmail.com. If you like this video, kindly like, share, and subscribe the channel. Thank you.